My name is Dr. Elizabeth Cody. I'm an assistant attending in foot and ankle surgery at HSS. I see all kinds of foot and ankle patients. Really anything that's wrong with your foot and ankle, I take care of it. So that can include arthritis, it can include tendon injuries, there can be cartilage disorders. I really take care of everything. The foot is so unbelievably complex. You know, there's so many different bones, so many ligaments, so many tendons. It has to carry our weight every day for thousands of steps. We really ask a lot of our feet. And so it's understandable that there are lots of things that can go wrong in the foot and ankle. And for me, when I see patients, I'm trying to figure out exactly where all the possible problems are and where they could be coming from. And often problems come from more than one place, and there are more than one issues that need to be addressed. So it is complex, and every patient needs to be thoroughly assessed to make sure that we're figuring out where all the problems are coming from. I think when patients come to see me, they can expect that they are going to come away with a much better understanding of how their foot and ankle work, and really of what's wrong with them. It's really important to me that patients really understand exactly what their problem is and what's going on, and most importantly, what they can do to make it better. I like to talk to patients about what their expectations are, what kind of level of activity is important to them or what they want to go back to, and really come up with an individualized treatment plan for each patient. My goal as a surgeon is to take really good care of patients, make sure that they feel invested in their own treatment, and to bring people back to doing the activities that they love to do. I'm an HSS surgeon, and I do surgeries at Stamford as well as at the hospital in the city. And it's really been great for me working out in Stamford because I can bring HSS quality care, including seeing patients and doing surgery, to patients in this area so that they don't have to come into the city, which has been really great, I think. I love seeing patients come back happy and pain-free. I think it's one of the most rewarding things about my job. And it's really what keeps me coming back to work every day, seeing how much better I can make patients.